Joining us now from Havana is Carlos Alzugaray. He's a Cuban diplomat and educator. Also with us from Havana is Gail Reed. She's the International Director of Medical Education Cooperation with Cuba. Joining us from Johannesburg is Carlos Fernandez de Cossio. He's the Cuban ambassador to South Africa. Thanks to all of you for joining us. Carlos, let me start with you. This is a major success story for Cuba, exporting its expertise, its knowledge, its know-how to the developing world and enjoying a great deal of success with that, despite the fact that it's been the target of an embargo led by the United States. It's faced sanctions. To what do you attribute Cuba's success?
Well, I think this is this medical internationalism is embedded in Cuban culture. You can go back to the 19th century when José Martí, the great Cuban poet, was the first humanitarian thinker. And that has been embedded in Cuban culture. And also the practice of medicine in Cuba. You must remember Carlos J. Finlay, who was the first, the discoverer of the Aedes aegyptis mosquito as the producer of yellow fever. Finlay made a very important research and actually discovered it when the American occupation of Cuba came. Dr. Oliver Reed became the guy who tested again Finlay's doctrines, and later Finlay was universally recognized as being one of the outstanding medical doctors of his time. I think these two important precedents give the historical context of what has been an outstanding cooperation of Cuba in medical terms all over the world, very well recognized even by President Obama himself at the Summit of the Americas in Trinidad and Tobago. President Obama said we should be doing what the Cubans are doing in sending medical aid everywhere. It's not only that, it's also the Latin American School of Medicine that exists in Havana.
Yeah, I want to talk about that in a moment. Let me go to Gail. Gail, as I mentioned, Cuba has faced sanctions led by the United States, yet it has been able to overcome this and make progress in the medical field. Now that relations with the United States have been restored, diplomatic relations have been restored, will we see more cooperation between these two countries, perhaps more progress from Cuba, perhaps more of Cuba's research and development being seen here in the United States?
We certainly hope to see more progress in collaboration in the health field. You know, health is very up close and personal to most people, and it is to the American people too, as much as to the Cubans. There have been great advances in Cuban biotech. It's one of the big three in the developing world with China and Brazil. And of course it has some major products that have come out, some recently and some they've had for quite a while. I think the most promising ones most recently are the therapeutic vaccines against lung cancer, childhood brain cancer, and also the new treatment for diabetic foot ulcers, which has reduced the risk of amputation here in Cuba and in many other countries by about 70%, which is a big reduction for anyone. And also, we still don't have a license to be able to sell this product in the United States. The trials, the clinical trials, have been approved by the Treasury Department, but we still don't have a license that is in the U.S. for sales if the clinical trials should go well. So this is a major sticking point right now for getting some of this medication to people who desperately need it.
Ambassador de Cossio, you are talking to us from South Africa, a country that has been a major beneficiary of Cuba's medical expertise. Take us through the benefits that a country like South Africa has got from Cuba.
Well, since liberation, since after the end of apartheid and based on an agreement between former President Nelson Mandela and President Fidel Castro, we've had a cooperation, we have a cooperation plan in the area of health, which includes the presence here of professionals. Today, the figure would be close to 426, and the presence of students in Cuba. The figure of South Africans today studying in Cuba medicine is 2,800 and something. And it's part of the overall approach of Cuba in Africa. Today, we have professionals cooperating in the area of health in a figure which is above 5,000 in all of the continent of Africa. I would say over 29 countries. And at the same time, we have close to 8,000 students from Africa studying in Cuba in the area of medicine. It's part of the relationship we've had with this continent, and it's part of Cuba's commitment to share what we have, to share the expertise and the capacity we have built in the area of healthcare with countries of Africa, a continent in need.
Carlos, we have heard Cuba's medical outreach program being described as medical diplomacy. Was there a time very early in the Cuban Revolution that Fidel Castro intentionally went about setting up this army of doctors that were going to be sent out throughout the world, that was going to export Cuba's expertise and know-how and give it a place, give it a voice in the rest of the world?
I think it is a combination of two things. The Cuban government's policy since the beginning of the revolution of making public health available to everyone. You must remember that at the time, Cuba lost about half of its doctors who fled to the United States because of political reasons. And yet Cuba carried out an expansion of its health programs and has achieved data in health protection in Cuba, which are similar to the most developed countries and even higher than most developed countries in terms of infant mortality, in terms of age expectancy. So Cuba developed its own health. But at the same time, there was this request of medical aid to from several countries in the underdeveloped world early in the revolution. Algeria, Chile, a number of countries needed medical health. And even though Cuba was constructing at the time its health system, it sent doctors outside Cuba. Now, I think this is the combination of the two things. One, the development of public health in Cuba as one of the main priorities of the revolution. And at the same time, what I pointed out before, Cuba is a country that is very proud about the achievements of the nation and what the Cuban nation can give to the world. And I think in health, this is very important. Let me give you an example what's happening recently. Cuba started a program of health with the Pacific Islands. Pacific Island kids are coming to study at the Latin American School of Medicine in Havana and other medical institutions in Cuba. Cuban doctors are all over the Pacific. That's far away, the other side of the globe. And you know who is helping Cuba and the Pacific Island in this? Australia, an ally of the United States, is furnishing the funding for the plane trips for these people. So it is part of the way that Cuba sees two problems: the issue of health in general in Cuba and in the world, and the thing about cooperation, South-South cooperation. Cuba is one of the champions of South-South cooperation in the world today.
Ambassador de Cossio, as you've pointed out, there's something like 30,000 Cuban doctors right now who are working, health workers as well, working in something like 65 countries around the world. Looking at it from a diplomatic point of view, and you're the professional diplomat based in South Africa, how has this Cuban medical diplomacy worked for the country?
Well, the term medical diplomacy is not one that I would use, but the whole program, what I would say, serves to help other countries. One of the features of medical training in Cuba and of Cuba's approach to healthcare is preventive healthcare. And in countries like South Africa, in countries like Africa and many countries around the world, it is preventive healthcare what makes a difference. Trying to keep people away from the hospitals, trying to reach out at diseases and prevent them from happening in the neighborhoods, in the communities, improving the health habits, the living conditions of people with basic elements. And I believe that that strength of Cuba's national healthcare system, which is the one that we project in many countries of the world, is the one that's having the greatest impact. In the countries where we are appreciated. The impact of this program has been huge for the benefit for millions of people all over the world, basically, of course, in the third world. So when one asks the question, what has been the impact? How has it been taken in the recipient countries? Of course, if you save lives, if you improve the living conditions of the community, if you provide or you help to provide this basic human right, which is healthcare, it is accepted, it is appreciated.
Gail, if we look at the development of the public health system in Cuba itself, it's a small country, an island nation that has more doctors per head than most countries in the world right now. So give us a sense of what it's like to be a doctor in Cuba and the Cuban medical system now.
I think one of the most interesting things about medical training in Cuba is that after 6 years of medical school, over 90% of the graduates go into a residency in family medicine. This is absolutely critical. They staff about 11,000 family doctor and nurse officers, which dot the country. Literally, you have the doctor and nurse next door. And for them, what it means is to be able to offer a more holistic approach to their patients. They live in the communities they serve, and they really get to know the families and the community. So they're not just looking at your liver. They're looking at if you have stresses on you. They're looking at your socioeconomic status. They're looking at environmental problems in the community. So I think it's a very challenging specialty to be in family medicine in Cuba because it has such a wide breadth. And at the same time, I think it offers them a real stepping stone to other specialties, a second specialty to which many of them aspire. That said, of course, there are problems in Cuba. This is a resource-poor country, and it's aggravated still by the U.S. embargo. So they don't have everything that they would like in the medicine cabinet. They don't have all of the instruments and all of the high tech, perhaps, but what they do have is very sound clinical judgment. And I think that is something that other countries and patients appreciate.